Giovanni and John, welcome to the show. And John, would you mind introducing yourself, please?
Sure. So I'm John Sousa. I'm a surgeon by training. I'm from South Florida. I went to medical school at the University of Florida, and then I went over to Stanford on the other coast to begin my general surgery training. I then transferred to a surgery program back home, close to home in South Florida, where I did another year and a half of surgical training. And around December of my third year, so halfway through my third year, I was facing some family issues and was actually tasked with running my family business, which was in real estate. So I was trying to run a real estate business and be a surgery resident at the same time, which you don't have to have gone through surgery residency to understand that might be a difficult undertaking. So that led to me basically taking time off from residency and eventually resigning. And it was shortly after that that I met Giovanni. And Giovanni was hoping to expand the firm and include someone who was interested in the entrepreneurial space and medical devices who had a clinical background. And I kind of fit that bill almost to a T. So Giovanni, being a recruiter, in addition to the businessman he is, he recruited me over to what we've called the dark side, but I now consider more of the light side of industry. So here I am today.
Excellent, John. Thank you very much. And I think Giovanni's probably saved you. Giovanni, could I ask you to talk about your background and how you ended up where you are today and how you saved John?
So Giovanni Lauricella, I was born in Buffalo, New York, and was there for the first chapter of my life, and then moved down to Miami for college. Never went back. And after doing college, I didn't do it nearly as fast as John did. So John skipped a fun piece of his story where he did a lot more schooling and a lot less time, but I did graduate university a little bit early. After that, immediately headed down to Central America, and then from there down to South America. Worked in some nonprofits, and then actually started a business in South America, sold it very quickly and nothing to ring the home bell about. After that, went back to South Florida, found myself still in the scathes of a recession, and jumped into working at Starbucks, trying to figure myself out, to be honest with you, while I was waiting to join my PhD program that I got accepted into, only to find out that the schools didn't merge because of the recession. And they said, you could still go to your PhD program if you want, but you got to pay for it. And I said, well, I got enough undergraduate debt. I still live here in the United States, so debt in the university is a real thing. Thanks, but no thanks. And ended up joining my previous firm, where I was there for quite some time, over a decade, and built this medical device recruitment practice for venture-backable startup companies. And that's everything from R&D through, we'll call it pilot commercialization. My main real focus was building up the international practice initially, which then sent me around the world. And then we started Lifeblood in January of 2022. That's my abbreviated version of how I lost my hair.
That's very good. Thank you for sharing that. I think Lifeblood has taken off in immense. It has quite a rocket trajectory since it's taken off. Would you like to tell me something about Giovanni? Would you like to tell me something about the company and what it is today?
So, Lifeblood, first and foremost, is a central magnet for passion for medical device innovation. And we do it from the sidelines of being able to support the companies and innovators that are actually doing it. Fundamentally, what we are a recruitment firm. It's an extension of my previous practice. And going into that, what we love to do is take an equation and wrap around what our center focus is. So that equation is, it takes money plus people plus community to actually grow and hit these milestones for these startup companies. So while we are centrally focused on the recruitment piece, which is that people portion, because we focus in venture-backable companies, we have very close relations with a lot of investors. And then what that has forced us to do is really build out that investor community and network, because a lot of the companies that we're working with are always raising capital, even if they've raised capital. So is that seed stage and they're looking for angel investment as well as family office? Or is that later stages, and we're looking for venture capital, larger family offices, possibly corporate strategic investments, hospital health venture arm investments. So that's really forced us to lean in and grab some great relationships with those investors. Not necessarily because we make money off of that as investment bankers. We're not investment bankers, but what that has forced us to do to be able to give that community of investors to our startups to help them identify and hopefully meet some new investors that they haven't met before. That's also enabled us to help facilitate a little bit more than 300 million for about 78 companies to date. In addition, going back to our main practice of recruitment, we get hired by a lot of boards and mainly the venture capital firms who bring us in through to their portfolio companies to put in the board level decision makers. So CEO positions, chief commercialization officer positions, chief level in general. And we also do a lot of independent board member development. So recruiting independent boards or members rather for the boards. And that keeps us focused on that hardcore focus of recruitment for people, in addition to the investor piece. So facilitating those investor connections in addition to being hired by those investors for their portfolio companies. So that takes care of the first two. The last one is community. So community means it's a semblance of partners, media, awareness, everything that it really takes to help an entrepreneur build a company. So they can't do it internally with their own people only. They rely on consultants, product development, CROs, clinical research organizations, recruitment firms like us, lawyers. And so what we do is we also bring together through our conferences. We host a great conference in Malta once a year called MedTech Malta. It's a 450 person investor and entrepreneur conference, smothered with some wonderful and very select service providers that add some really good value. And then we also do CEO only events that we like to tack on to other conferences around the world. So what we do is fill a room together full of medical device CEOs or MedTech CEOs. They have a very unique position in terms of facing very unique challenges that even the COOs, the CFOs, and the individual contributors don't necessarily have to face. So putting these like-minded peers in a room and realizing that they're not as alone as they think they are, and having them have a 2-hour session to vent to one another and support each other with not only questions, but responses, forges these networks together. And then we also host our own podcast and have done so through a couple different media sources, sharing that information on not only what it means to build companies, but a lot about raising capital and the challenges that come with getting inside the investor psychology from being a either first-time founder or even multiple-time CEO, and some of the challenges of different phases of the game of this market today, that market last year, the markets to come, and how do you handle those challenges. So going back, it's capital, people, and community to give all this back into the ecosystem so that they can keep on growing and doing their thing.
I think it's important to remind people that you don't just do the United States, you also do Europe, which is where you currently are today.
So we actually do the globe. So we do certainly US. I would say realistically we're 50-50. So we actually I know that because we looked at that in our December strategy meeting. So we're about 50% focused on the United States, 50% rest of world, with about 85% of that rest of world making up Europe. I was just in Israel a couple of weeks ago, so we do a lot of Israel or Israeli work coming over to Europe or the United States. We've done tech transfers to China. We've done Australia coming over to Europe and US as well. Building teams over in Asia Pacific, and even specific to building out R&D teams in China as well. So we've done some pretty unique roles, but a lot of what we do is to your point in Europe for sure.
Okay, fantastic. Thank you very much for that. John, I'd like to probably ask you about how your background in medicine, medtech, is probably pretty much invaluable to your clients. Can you tell me something about that?
Absolutely. So I think there are a few elements that make it particularly useful. So one being when you enter an environment, an ecosystem, an industry like MedTech, where there's a lot of very esoteric knowledge that is contained that has to do with the function of the product, like the devices themselves, in addition to the specific elements of running a MedTech business and the regulatory aspects that go along with it. Having part of that taken care of with my expertise in surgery specifically, I'm very familiar with medical devices and I understand their clinical applications. So that kind of accelerated my onboarding into the MedTech industry, where I could really focus on providing value from the clinical aspect, but really also learning on my end from people on the business and regulatory side. So that's one aspect where it's been particularly helpful is helping these startup founders, for example, adjust their pitch decks, adjust their clinical messaging, get them in touch with specialists that I know in their field that can offer additional specific clinical guidance. And that kind of plays into the second aspect that I think is helpful, is having kind of a built-in network of specialists across the therapeutic areas that I have excellent relationships with, that can easily make introductions to. And many of them are not super integrated into industry and are interested in it. So it really plays a dual-pronged, they're a dual-pronged benefit of helping my colleagues on the clinical side get introduced to industry, and then my industry friends getting introduced to specialists in their field. So those are some of the ways that having that clinical background and clinical network has really helped. It also, of course, helps a lot to speak the language of the physicians with physician founders, for example. And since I'm learning that business side as well, it helps me speak their language and also teach them some of the business language that they may not know. So that's another kind of specific help that my background has afforded me.
I also think that you can offer a lot of VCs and a lot of funders a great deal of knowledge about the value proposition that these particular investments present to them.
Absolutely. And a lot of VCs do have a network of physicians that they can call on, but to be honest, it is extremely helpful to get outside perspective too. So helping them expand their networks into different specialists that can help in their due diligence, and also playing a role in that with my specialty of surgery. I completely agree. Helping VCs with their diligence process is extremely fun too.
So you're protecting people's reputation. Also, what you're doing, you're protecting people, startups, investors, individuals from making mistakes.
In many ways, yes. I think that when a founder goes to pitch to an investor, for example, they have to really know their stuff and know what they're talking about, almost to the degree of a clinician, how a clinician would speak about the unmet need that they're addressing. So being able to teach them, if they don't know already, some of the questions that they might be facing or aspects that they need to think about prior to going into these investor pitches is particularly helpful. Absolutely.
Absolutely. So I'm going to ask both of you a question. I'm going to ask you about a case study. If one of you or both of you could give me a case study that you've been involved in recently that you could highlight to people about the successes that you've had with your clients. Perhaps, Giovanni, would you like to start?
Oh, man. Well, fortunately, we've had a lot of successes. We're in the midst of a lot of processes ongoing that hopefully will lead to successes. So I'm just trying to find a juicy one that I would love to be able to share.
I quite like Verb Surgical. That's one of my favorites.
Oof. Okay. Well, Verb, that was a very high, quick scale up. So
Yep.
we actually started working for Verb before Verb had a name. And I remember going out calling it Newco for new company. And the unique piece about that is, at the end of the day, what you think of as a recruiter, we are a multiplier and an extension of the company on a high volume scale, being able to tell their story, right? So there's a company story, and we go out there all day long and tell that story over and over and over and over again to specific people that should be aware of the story. And so before Verb had a name or anything really to share, it was quite challenging going up to really caliber people and saying, hey, I got something that's going to be really interesting for you. It's called Newco. It's definitely not the name of the company. It will have a new name soon. And by the way, I can't tell you anything about the company. Can I have your resume, please? That was quite challenging. And then fortunately, that phase didn't last too long. And once it happened, there was really phases of recruitment that was quite unique, where we're talking about bodies. I mean, we needed people very quickly who wanted to get their hands dirty, were true startup people. And it's like everything else in the startup world. You start with this absolute limited resource, meaning human resources for sure, in terms of the amount of bodies involved. And everyone's doing a lot of different things. And as you start scaling, everyone starts getting more specified. And it went from the Wild West of less than a handful of initial people to we wrapped up at the high 300s, where we were getting down to data analysts for this particular piece or that particular part of the project or that particular next generational device. And it got very specific. So that was a wild success. It was a unique situation because it's a scale up, so that doesn't happen every day. But what I would like to say is, and I don't want to take John's thunder, but John's working on a really cool position right now that he's been able to get over the line, and leverage his MD degree. So I hope that he speaks to that one. But we've been able to do the high volume scale ups, but I think even more so, some of the more interesting and rewarding ones are those ones that have like 4 people in the world that can do the position. And we have to use our strength, patience, skill sets, and process to be able to pull one of those 4 over the line. And those are, I feel like I'm James Bond whenever we have to do something like that. That's fun.
007, that's fantastic. I love the analogy. All right, John, please let me know what you're up to. Thank you very much,
So-
Giovanni.
Yeah.
I all the ones that Giovanni mentioned without saying the names were things that popped into my head. So one of the ones that Giovanni's referring to quite recently, where there were probably not even 4, maybe just one person in the whole world that could fulfill a certain set of criteria, was an engineering position. We were searching for a heart failure company that they needed this extremely specific combination of mechanical and chemical engineering expertise that it was just not, it is such an innovative device that there really has there's no one that would be able to provide the engineering expertise that they were looking for. I don't know if I can say the name, Giovanni, you tell me, but is it okay?
Go for it. Why not? I'll get slapped on the hand
So
later.
So the company was called Cardiac Booster, and they're developing a very interesting product to treat heart failure. And I understood the clinical importance of what they were building, and they were building it in a way that would really drastically change the longevity and the cost effectiveness of the procedure, which I understand in that world, having treated those patients in the ICU. I understand how important the innovation they're trying to create is, and they needed like a very specific piece of expertise to help create a specific part of the device that there really was no one that had that combination in one individual, and we found them. And we found that one single person who had worked on a device just similar enough, in the sense that they were the leader that conceived of the idea for that device. It was close enough to what Cardiac Booster was trying to build, and they were available for Cardiac Booster, and we put them together, and they otherwise likely would have never come together otherwise. So that's just a testament to our kind of network and being able to find those specific situations. Another one that Giovanni is referring to is a company called Conformal Medical, and we're actually hiring a position to manage all of their safety related issues with their clinical trial. So as a clinical trial goes on, various events need to be reported to the sponsoring company to determine if an event was caused by a device or not. That's a specific role, and there are a few people who specialize in that, and a lot of them are former clinicians. So being able to leverage my experience as a clinician myself, and being able to contact them and get them on the phone to at least present the opportunity to them, and then get them excited by being able to speak to the specifics of the device, the specifics of the trial, and the specifics of the type of information they're going to be looking at. Having that information at my disposal made it so much easier to get candidates interested and on board than giving them like a very high level overview and just saying, oh, I don't know, you'll need to ask them about that or something that's not my area of expertise. Being able to speak that was also super helpful in getting them interested. So that's what I would say. I would pick two. Yeah.
Thank you very much. You've also both been involved in fundraising strategies and investment banker promotions. Can you tell me something about the fundraiser strategies that you've been involved in? That's an open question.
Yeah, the fundraising piece has been interesting because every company that we deal with and touch needs it. So it's even more than our core focus of recruitment. Sometimes they're recruiting and building teams. More often than not, they wish they were able to expand, but they need the capital first. Medical device fundraising is really interesting because I'm going to make a bold statement, and I will definitely be able to be proved wrong because a lot of people, which in the grand scheme of things is still select few amount, have made a lot of money off of medical device exits before. In general, medical devices does not fit the normalcy of venture-backed constraints of what venture is truly looking for. The amount of unicorns in medical device is pathetic in comparison to high tech. You know, when you talk about unicorns being billion-dollar exits, et cetera, I mean, we could probably draw up a list before the end of this podcast as to how many billion-dollar exits have ever happened in medical device. So realistic, and then you deal with a 10-year constraint on a typical venture capital fund when you're dealing with most companies that take anywhere between 7 to 15 years to exit. So how do you really put that into a strategy? And, you know, a lot more of the word impact has been thrown around, especially lately, as this whole illumination of how MedTech should be invested. Because realistically, that's what it is. It's healthcare technology that takes way too long, that's usually out of its entrepreneur's complete control because you're dealing with third parties like notified bodies and the FDA. And they can, you know, flip the coin and say, yes, I approve you. No, I don't. And then if they don't, it either adds on years to going back and doing it again. And by the way, tens of millions of dollars. Or if they say no and you're out tens of millions of dollars and years. So it's not really a great venture backable asset when you ask yourself the question, should I be putting in this dollar into real estate or cryptocurrency or the public markets in general? Or do I want to put this into a privately held medical device company? Once again, there's wonderful exits that's happened, but is it the norm? Absolutely not. And so when you have these companies that are going out there and they're going to conferences and they're raising $800,000 from angels or 2 million from angels, it's a complete waste of their time. They're not going to conferences because they're going to get put on stage one time and someone's going to be like, wow, that business model makes complete sense. Here's a check. And I can't wait for you to give me a 10x multiple in 3 years or less. It's, once again, in general, not going to happen. So when you deal with fundraising strategies, I mean, I'm going to be speaking from general terms here, but living off of grant funding to get to clinical trials is a really great strategy. I know it's what a lot of entrepreneurs don't want to hear because it's not going to put them on podcasts and put them onto pitching competitions and getting them a bunch of social media. But your best bet is to stay in your dungeon, hire a grant writer, and just go grant after grant after grant after grant, or go out and sell to people and angels and family offices that have no time constraints on the fund and tell them that they're making an investment into impacting healthcare, and likely they'll never see their money again. But at a minimum, you're moving the needle forward into science. And they might be okay with not seeing their money back. I've invested into 7 companies myself. Every time the ink dried on that check, I knew I was likely never going to see that money again. But the ride and the experience and the network that has come from that exposure of actually going on those rides with those entrepreneurs has been wonderful. It's been very insightful. So, you know, when you're an early stage company, I would strongly recommend going after family offices that want to do impact investing and writing grant after grant, because what the VCs and even some of these sophisticated angel groups are requesting is come back when you have clinical data. Well, okay, how do I get to clinical data if I don't have your money to be able to spend on operations to get to clinical data? That's what everyone is constantly scratching their head about. So realistically, save yourself time. Don't travel the world going to all these conferences just because you want social media effects. Get grants and sell to people who don't care about getting the money back. Go all the way, get your prototype done, go into first in man if possible. And then when you start getting that positive data back, then you can actually have somewhat of a business plan wrapped around with timelines on regulatory efforts and clinical milestones so that you can go to a venture backable, or I should say a venture capital firm, institutional money, and say, this is my actual business. Anything before that, it's not really a business. It's a thought and a dream, and it's going to iterate 15 times before it hits a commercial patient. So fundraising strategy, early stage, know where you are and know what the actual institutional capital is requesting, and then figure out what it's going to take to get there. Once you get there, then good businesses get funded. That's a fact.
I think this is something that you haven't mentioned at this point in time. You can also help with organizational development, can't you? And that's something that you have done in the past.
1000%. And actually, I'm sorry for being late to this podcast. And that was actually part of the reason, because I was just wrapping up a client call that we're doing a chief operating officer for, and they are raising a $54 million round. And out of that 54, 32 million of the 54 is actually already spoken for. So it's already raised. They're looking for an institutional to come in and just take on that last bit of effort, or maybe two, maybe if they want to syndicate it. But their big question is, yes, we could take this chief operating officer on right now. We'd prefer to have the money in the bank, but what we actually think is, if we bring on the right chief operating officer now, that actually even gives further confidence to our timelines and milestones and business plan to the investors, so that this chief operating officer may even, as a matter of fact, help us raise the remaining bit so that we can close this round. So we deal with that in a plethora of ways, where there's a seed company that needs a new CEO to go out and raise a Series A, and pending a lot of economics that have to fall into place to make that happen, that's certainly true. A lot of the times we do have to do organizational development on the management team, because there's that chicken and the egg effect, or even or independent board development, because there's that chicken and the egg effect where the investors are looking to invest in a team and they realize the team is not really investable in this current state, but the company's looking to raise capital, but they don't have the capital in order to go out and hire the executive management to satiate and appease the investors. So you have this chicken and the egg situation. A lot of the times it's solved with really bringing on an excellent independent board who can be that door opener, and all that it really costs you is equity in terms of bringing on that independent. And we do, John and I actually, we're cleaning up on a awesome independent board director role right now for a Cleveland Clinic portfolio company, which I'm super proud of. And John did an amazing job at that. But there's a lot that you can do in terms of organizational development, where how do you design a management team and a company that tells a story to make the company more investable.
Thank you very much, Giovanni. That was excellent. John, speaking of bringing on interesting people, you've got some wonderful industry partners in your organization. Can you tell me something about that, please?
Absolutely. So what we seek out in industry partners are people and firms that have similar mentalities as us to addressing problems and really to helping the industry, because we're as a firm very firm believer, no pun intended, firm believers that that a rising tide lifts all boats, and we want to provide service to the industry to make sure that companies have the resources to be successful, and more companies that succeed, the more business there is for everybody. So our goal is to partner with other industry members that feel the same way and don't have that kind of hyper transactional extremely like quid pro quo tit for tat type relationship with everybody else. We really find people who are dedicated to serving the industry, are passionate about serving the industry from the MedTech perspective, and kind of fit that mold. So people that we partner with it's very selective. We partner with a very small percentage of the partners or the people that we come in contact with. So it really is a testament to the ecosystem that we've built.
Absolutely.
Lifeblood's future is actually a byproduct of the networking effect that it's been taken on since its inception. So, we are full-time dedicated to being recruiters, talent acquisition for medical device and MedTech startups. And once again, that's from incubation all the way through pilot commercialization. Because of that, it forces us to be in this community of both investors and really strong partners. And also it's enabled us to kick up a lot of dust of opportunity for our own selves in terms of Lifeblood's future. So we're never going to deviate from being the talent acquisition firm. That is literally our ear on the street. We are able to have access to information and what people tell us and companies tell us where the industry is going, where the job industry and market's going, how people are hiring. It gives us an amazing amount of insight into the industry that I don't believe most facets of the industry are privy to. And at the end of the day, it's people for people. So that we're never giving up. However, what it has taught us how money flows. It has taught us what companies and people are truly interested in, and the amount of intensity of wanting to be connected together. And so at this point in time, what we're planning on doing is always being very close to the investor community. We are going to be putting together an investment vehicle to be able to help out these startups in the future. And also, in addition to that, maintain our community aspect of being able to build conferences and also add on to our CEO only conferences. So maintaining that equation that we started off with, talent plus capital plus community equals enabling startups to hit those milestones. We really want to be able to put our arms around all that, never deviating from our talent acquisition business, being able to facilitate capital in our own way, and then also being able to put together the community aspect of building conferences that bring the right people together in order for us to enable the entire ecosystem to come together like we've always intended. And that's the reason why I don't think we're ever going to leave this industry minimally for the next 30 years. That's our dedication. And thank you very much
I was just saying, I think you're both quite unique in this industry. So I'm pleased that you're part of this ecosystem and you're making a big difference to the world. So thank you very much, both of you, for your time today. It was a great honor for me to have a talk to you. So thank you.
Thank you.
Thank you, Stephen.